Thank you. Now, we head now to Akwa Ibom State, where Governor Umo Eno has pledged stronger investment in healthcare, assuring residents of his administration's commitment to quality and accessible services. The governor's message was delivered by the Commissioner for Health, A.K.M. John, in Uyo. Miriam Daniels has the story.
In Maiduguri, sounds of hustle and bustle fills the air. As behind the cheering activities, a deeper story of resilience. For children in returning schools, independence, a statewide insurance scheme, ambulance services, and a 350-bed international hospital underway. But Governor Eno says the biggest challenge is manpower. He has now approved the recruitment of 2,500 health professionals, the single largest intake since the state was created.
The emergency we recently declared in the healthcare sector will address the gaps in that sector. We hope to flag off the construction of our 350-bed Ibom International Hospital along the medical corridor.
The health commissioner also addressed viral claims of negligence at Ikotipene General Hospital, warning against false alarms and harassment of health workers in the name of content creation. On a separate case involving the death of a mother and her baby, he said investigations are complete and the findings will be made public soon.
The investigative committee was inaugurated and I handed them over personally to the chairman of that committee. That is not the action of a government that wants to cover up any wrongdoing. Never. And that committee came up with its findings. It was presented to His Excellency in ESCO, and he immediately directed that I should forward it to the Civil Service Commission, and they must sit and look at the recommendations of the committee in line with the extant public service rules and ensure that fairness and justice is upheld to the end.
Information Commissioner Anekan Umana, meanwhile, outlined recent achievements under Governor Eno's Arise agenda.
There's so much going on. When we talk about tourism, it's still part of it. The convention, the 5,000 capacity convention center that's under construction at the Tropicana complex, the Ibom hotels that's going on the 200 bed, and then the Arise shopping city that's coming up, all in that ecosystem, that corridor. All will add to the infrastructure stock, even though it will drive tourism, but will add to the infrastructure stock within the state. Everything, whether it's health, education, roads, and so on, they all add to the infrastructure stock. But of course, they drive various areas of development. And that is why His Excellency was very methodical in designing the Arise agenda.
The state government says a comprehensive health reform bill will be ready by December, promising to reshape healthcare delivery across Akwa Ibom. Miriam Daniels, TVC News, Uyo, Akwa Ibom State.
Miriam Daniels is in Uyo and is joining me on the news this time round. Miriam, Governor Eno declared a state of emergency on health. From your reporting, what exactly triggered this decision?
Okay, what triggered this decision was the shortage of manpower, especially owing to the fact that the government has made a huge investment in the health sector in terms of health facilities and other equipment that are required to make the sector functional well. And the shortage of manpower is the actual challenge facing the sector. We recall that recently there was a viral video of a lady who lost her sister and a baby at the General Hospital in Ikotipene following an alleged negligence by doctors who were on duty. And that's a situation that the government went into investigation, and it is expected that the final report will be made public and the justice will be served to that family. And several other reports too of people who visit, especially public health institutions, who end up with one challenge or the other. So the government says, okay, we have sunk in quite a lot in putting the structures in place. There is the need to have enough hands man these facilities. And so it declared a state of emergency to include upgrading the health facilities, the health institutions, public health institutions across the state. It might be interesting to know that the Akwa Ibom State has about 319 primary health centers and about 42 secondary health institutions. So the government says it wants to upgrade the institutions. The government also says it wants to employ more hands, about 2,000 health workers, even those who are retired from public service and are willing to give their service to the government. Government is willing to employ them to make sure that these holes are closed and it gets the best out of its investment in the health sector, knowing too well that the idea behind this is quality health care for Akwa Ibom people. So you can imagine a situation where, for instance, the government is making a huge investment in primary health care, 31 model primary health centers across the state, and there is really nobody, not enough hands to man this. And also, the government also has a concern about investment in personnel in the health sector. There is currently an issue going on about some doctors that had been trained by the government who decided not to serve the people, but go about doing the normal businesses. So all of these attitudes bring the loopholes, bring the spaces that we have in the health sector.
Yeah.
And the government said this has to be taken
Miriam,
care of.
if you can hear me. Yes, you've actually given us statistics and what the government, generally is doing in Uyo. Let's talk about Akwa Ibom State. But the state has modern facilities, insurance, even a 350-bed hospital under construction. Yet, the governor says manpower is the real challenge. Why this gap, do you think?
Yes, perhaps, what the government actually invests in personnel, as I had mentioned earlier, is the data syndrome thing, where the government invests in training these personnel and with the hope that they will plow back the knowledge, the skills that they have learned into the system to help a private resident. But they go about their other businesses. Some perhaps would have traveled out of the country, would have gotten elsewhere outside the state to go and serve others. So the government now says, going forward, as it is going to train its personnel who have to come into a bond with the government, say, for this period of time, we agree that we are going to stay back and serve the Akwa Ibom people. It's an issue of the government investing and then the investment being taken outside the state. So leaving the state to suffer, leaving the wastage in the investment in the health sector. So that is where the gap comes in.
Well, Miriam Daniels, keep close tabs on this for us. We'll definitely always reconnect with you to get updates from Akwa Ibom, Uyo State. Thank you, Uyo State, Akwa Ibom. Thank you so much, Miriam Daniels.